So I am Dr. Teresa Green. I'm the Freedom Cultivator, and we are having a collaboration today with Rebecca Zeleny, who is a licensed clinical social worker. And she and I decided that it would be a good idea to ask the community what kinds of questions they had about coaching and therapy. And we got a few questions back, so we're going to go over those, and then we're also going to talk about whatever else comes up. So it's very informal and fly off the cuff, so there's no what will come out of our mouths.
You have a bleeper on this?
I know, yeah. We'll have to insert those. Rebecca, do you want to talk about kind of how you and I know each other, or how this came about?
Well, actually, this is the first time I'm meeting you. I don't know you. No, we're from the same little small town. But we met each other, well, we've known of each other for a long time. And then I had you coach me. And that's how we know each other.
Yeah.
There's a lot, I mean, there's more to the story, but that's not why people want to listen to us.
Right. But I think it's just kind of interesting because it was pretty intimidating for me as a coach to have a licensed social worker reach out and say that they wanted to be coached. And I just really appreciated the trust that you had in our relationship to be able to do that. And then also what's grown from that, because like you and I have gotten closer, and it just kind of blossomed into this. So we'll see where it goes.
Right.
But
exactly. It's exciting.
I know. So tell us a little bit about what you currently do.
Currently, I have an office here where I live in Eureka Springs, and I'm primarily moving though into online e-counseling, e-therapy, also known as teletherapy, where I feel like that's where therapy, coaching, all the helpful fields are going towards. So right now I'm working with BetterHelp as a contracted therapist with them. And then I see people in my office as well, but also seeing people online outside of BetterHelp as well. I'm trying to build that part.
Nice. So let's get into it, I guess, unless there's anything you want to add to that.
The big question.
Yeah. Okay. So one of the questions that we had was, how does life coaching in general differ from a standard therapy session?
Right.
You want to start that, or would you like to?
Well, I think you were right. We probably should have recorded this beforehand when we were talking about it, because that's something I personally have struggled with, because I don't know how to explain it, or I felt like I didn't, and I've been really searching for my own understanding, because my experience in working with you and what I've seen online and read, and then personal therapy experience, is that I don't see that there are like extreme differences. I feel like they complement each other, really. I mean, there's obvious differences, like I can diagnose people, I can bill insurance, but I don't, a lot of that stuff, that's not what they're really looking for. I mean, if that's what they want, I can give that to them. But they're even in therapy sessions right now, a lot of people come in and they have no idea what their diagnosis is. Nor do they ask, or do they really want to know. They just are looking for help. Now, some people are coming in looking for a diagnosis, which I can provide them. But honestly, we as therapists are trained to diagnose, and we do it primarily for billing purposes. And we will do it sometimes because we're thinking in our minds constantly. From the moment we meet somebody, we're trying to figure out, we have all these tools and all these different theories and routes we can take, and we're trying to figure out and join with the client on what works best for them. I mean, that's my perspective from a clinical social worker, and clinical social workers are trained different than a psychologist. I think if you go to somebody that's a psychologist that's maybe in their 50s right now versus a licensed clinical social worker, you'll see a very big difference probably in how they practice. I'm not super familiar with what they're doing now in grad school for psychology degrees. I'm assuming they're probably making some changes, but our field has really grown. And as a clinical social worker, I'm trained to meet the client where they're at, and we consider what's going on, you know, inside your head, but also your environment. And it's very important for us to join with you, which is also very similar to coaching. I feel like it's a team. And so I've personally struggled with, how do I explain what's the difference? And I've been going about this probably for 9 months.
Yeah.
And I read a really great article last night that I felt was very helpful, that it's just, there are some differences, but then there's not. And it's really, I feel like, who the person connects with, whether that's a therapist or a life coach. It's really about a personal connection.
Mm-hmm. Ultimately, I believe that too. And what I try to tell people is that every profession has really good people who practice and people who you wonder how they got there, or maybe you just don't click. Um, so I think what you just said about having the connection and that energy between each other is just really important, because trust is the foundation of the relationship. And I will be very upfront and state that you have to be careful when you look for a coach, because the coaching industry is not regulated. They they are working toward something of that nature, because coaching is growing, and it has been growing for years. So when I looked into coaching, I personally went through a program that was accredited through the International Coaching Federation, which does put some criteria and mandates and regulations together. They have a code of ethics and like standards that they teach for us to use. So I just always feel like education is really important, and to be trained appropriately, because I know that, like, if you say the wrong things, or practice in the wrong way, you can really damage someone, and that's not why we got into this. We got into this to help people, and sometimes even when somebody has the best of intentions, if they're not trained appropriately, then that may not go well.
Right. We have the same thing as therapists, where some therapists are practicing outside of their abilities. There are certain things that I don't feel comfortable treating, because I don't feel like I'm an expert in those areas. Where if you do decide to go and take a client in an area that you don't feel comfortable with, then it can be very damaging. Mm-hmm. So I think it goes for both coaching and therapists.
Okay. And then I think as far as the process goes with coaching, typically you would find there would be a free consult call to find out mutually if they feel like it's a good fit, a discussion about the process for coaching, and an agreement that talks about what we expect from each other, that would be signed by both. And then you would proceed in coaching sessions with an agreed upon time frame and length and things of that nature. So what does that look like for therapy?
Well, it can vary depending if you're in somebody's office in private practice, because they have a little more freedom, or if you are going to an agency, you're going to have a lot of paperwork. Or if you are doing e-counseling, it really varies. For me personally, I am willing to do like a 20-minute get to know each other session, talk about what they're needing. I feel like we're the right fit? And there's really not a lot of paperwork. Really what we would do is a consent to treat, which is probably like you're very similar to your agreement, saying that you are allowing me to work with you. And I legally have to get that signed because I have a board and a license that I have to protect. Some places don't. Some people don't do in therapy do the free beginning session or 20 minutes. And some agency, when you go to an agency, they're not going to do that.
Right.
I think when people think of therapists, they think of, I've got to go to somebody's office in some boring building with some really outdated furniture and with bright ceiling lights and with maybe untrained people or really dry and boring therapists. Mm-hmm. And that can happen, especially, in community mental health centers. They definitely serve their purpose, but it's not for everybody. But there are plenty of people in private practice that are in their offices or they're online. I mean, a lot of therapists are moving online because they recognize that's what people are needing because it's convenient. Mm-hmm. And I think part of our issue as therapists is why we maybe haven't moved online years and years ago was we have this billing thing. We've always struggled with people wanting to pay for helping themselves. That seems to be a growing concept, which is really great because people's mental health, their happiness is so important. It's important as your physical health. As you go see the doctor or the dentist or the eye doctor, why wouldn't you go seek help for feeling happier, mm-hmm. more alive? So we would always run into the insurance billing issue, but we don't have to bill insurance. And now some insurance companies are catching up with e-counseling and they actually are paying for it.
That's wonderful, so that it's more accessible to people and it can be in a more convenient location or time even.
Yeah.
So I guess for me as a coach, if I'm coaching someone, and first of all, let's talk about how with a coach, and it's a lot like counseling, I'm sure, but we are trained, or I was trained to ask the powerful questions and really listen and be present with the client and be empathetic with what they're going through and kind of help them move through that. And that may mean that we touch on the past, but you're always trying to move them forward through that. So if someone's in a session with me and they keep going back to their past and they're hanging out there and or they're describing to me symptoms of clinical depression or some kind of significant anxiety, or some kind of personality disorder, then I would let them know that, I've been trained to let them know that I am from the forefront, I am not a therapist, and I would be referring them to a therapist. So, because that's just beyond what my skill set is. And so because of my other background with my doctorate in education and special education and all of that training and behaviors and things of that nature with kids, I know a lot about that stuff. So I feel like it's a coach's responsibility to learn about medical mental health conditions, mm-hmm. So that they can make proper referrals, because that's not what you've been trained to handle or deal with. And so mm-hmm. I think it's a very natural and good. It could be a really good, smooth transition if therapists and coaches could either work together, or as a therapist, if you can figure out how to mesh the two with coaching, which I know can be tricky, and because you guys have your licensing boards,
right?
So yeah.
I was thinking too, how would you handle something if somebody comes to you and they say, like they're wanting to know why do I keep doing these things, the why. Say in these relationships, we'll use a relationship for example, and they keep ending badly. Why is this happening? How do you address that?
Yeah, so I just asked them.
I'm not trying to put you on the spot.
No, that's fine. Yeah. I mean, obviously this is different than an actual session where somebody's giving you specifics, but I think I would keep asking them about the relationship and some of the history there. Navigate through getting to their past and what their relationships were like, letting them know, again, depending where our relationship is as a client coach, I have to build that trust and know that I'm going to have to ask them some hard questions, which I also try to let clients know right up front that I'll have to do that. And I try to warn them before I do. Right. So I'll be like, I'm going to ask you a really tough question right now. Is that okay? Right. But then kind of try to go back to their past to see, okay, well, what were your relationships like with your family? Or, oh, okay, so you were in foster care. Like, tell me more about that. Okay. So I just kind of ask the questions and really listen and then try to pinpoint the things that could be connected to where those unhealthy patterns are coming from. And also explore their whole self-love, self-worth aspect. And that's what I think takes me back to the history more. It's like, oh, okay, so you have this negative self-talk, like, tell me what you're telling yourself in your head.
Right. Okay.
How do you?
That's very similar because from my perspective and how I practice, because I really can't speak for every therapist in the world because everybody's different.
Right.
But from my perspective, I would handle that very similar because I would want to help them answer the question, why does this keep happening? Because it's obviously become a pattern. And it's a pattern they're not comfortable with or happy with, and that can be changed. But it would be going back to listen to some of these stories of what was going on. Are there any similarities between these relationships? How are they feeling? And then behind that, what are they thinking? That's a struggle because most of us aren't paying attention to what we're thinking. We recognize the feeling, but not what we think. And basically trying to see if there's a pattern there and then presenting it to them, asking, do you see that there's a pattern? I'm possibly seeing this. What are your thoughts?
Right. And it's so important to keep that client engaged with you and keep the trust as you're doing that, because they really either think they've worked through that or like it's not affecting them right now, whatever it is that they've endured.
Okay.
And then you kind of have to keep them present with you to walk through those questions and then be able to make that connection so that they're like, oh my gosh, I never really thought about that. And sometimes they need to think about that for a minute, marinate on that, and then in the next session they're like, yeah, and they brought up this other stuff. Or maybe sometimes that I'll call it intuition, that intuitive thought that I might have had as a coach to make that connection isn't correct. And at that point, that client needs to feel comfortable enough to be honest and say, no, that's really not it, because in a session, I'm not the boss or, it is a mutual co-created relationship. I'm the energy and that person is trying to, I think like we had said off whenever we weren't recording, they're going through the discovery.
Right. And I would say the way I practice is similar to that, because as a trained clinical social worker, I'm trained to meet the client where they are and then try to join with them, making them feel comfortable because my ultimate priority is it's a safe place and a place where you will not be judged. I hold no judgments about anything, and you can say whatever you want and it's going to be private. Of course, there are some reporting guidelines, which I think you might have too, but it's all about creating a safe place for them and letting them know that if they don't like something I've said, or they feel like this session is going totally off the rails and it's not where I want to be, that I want to empower them to tell me. Because I'm not the old psychologist sitting up in a hardback chair analyzing you and you just have to do what I say.
Mm-hmm.
That's not where I feel therapy is anymore, and that's not how I practice.
Mm-hmm. Well, and my experience, and I'll be honest, like whenever I had gone to a therapist, like I couldn't tell you now what their credentials were.
Really?
Yeah, I really don't remember. I know I've gone, like I went to the office and talked to them, and it, for me as a client, it was, I was looking for that connection piece for somebody who would understand where I am and help me through it. And I don't feel like I ever got that.
Mm.
But so I think that kind of hindered me from getting more therapy. And I wish that I would have known about coaches. Then in my mind, I'm saying like, this is kind of coming from ignorance. You know what I mean?
Right.
I just didn't know, a long time ago. But what I liked about the coaching aspect, which, as you said, like you practice differently than probably the people. I know they weren't social workers who I went to.
That's maybe the difference.
Right. And it would have been really nice to go to see someone who could have said, well, help me make those connections, maybe give me a little bit of homework or ask me what I wanted, and made me feel like I did something other than just filling my guts during a session and then wonder what they're thinking about me. Because I do, you know what I mean?
Right.
But then those were my own issues that I had with feeling judged and things like that I had to work with. So it's all really
Right. No, I feel like coaching and therapy really go nicely together. They complement each other. There's a lot of, I think, similarities, but, there are some differences too.
Right.
It really, I feel like, depends on probably who your coach is and who your therapist is. Because everybody practices differently. Everybody takes different things out of the training they receive. And then everybody has their own personality. So some people just don't connect.
Right.
And that's okay.
So I think, Amy had asked this question, and I know other people have this question, but bottom line for me, if these,
I told you they would bark.
That's okay. I don't mind it at all.
Well, everybody else just is not going to have to mind too.
But bottom line for me, you're a client, and whether you're looking for a coach or therapist, I guess I'll stick with a coach. I personally think it's important, obviously, to have the connection and get with somebody that you feel you can trust, but also look into how they were trained, what that looked like. Was it ICF accredited, which is International Coaching Federation accredited? In a session, they should not be giving you advice. That's not coaching. A coach is not there to tell you what to do. A coach is there to help you explore what it is that you want and commit to it and do it. So they should be asking the powerful questions through that process and help hold you accountable to follow through with that. And what else was I going to add to that? I don't remember. Maybe it'll come up. But for you, what would that look like from a social work standpoint?
For the first session, or?
Just like if I'm a client and I'm looking for a social worker, like what advice would you give me to make sure that I have a good experience?
Okay. It's actually very similar or the same as yours. Making sure you connect. I think sometimes people with us, because they want their insurance to pay for it, they need to make sure that we accept it. And it's just really got to feel comfortable. I feel like as therapists too, or how I was trained, I'm not trained to give people advice or tell them what to do. There are times when I may make suggestions and always say, you don't have to, that's just a suggestion, but I'm never going to tell somebody what to do because it's their own personal experience and they have to use their own strength to decide what's best for them. I don't live their life.
Right.
So I would say it's basically the same.
Okay. So we do have another question. Do you have anything with that one?
Sure.
Okay.
What is that one? I think I know it. Anxiety and how would a coach and therapist differ with anxiety and PTSD?
Well, she was just asking in general. She wasn't necessarily asking from a coach or therapy.
Okay.
I don't think, or if she did, she wouldn't clarify. But Robin wants to know, how would you navigate through PTSD and panic attacks?
Well, it really depends on the person because I practice from once I meet somebody and get a feel for who they are and what they're looking for, then I determine what I think might need to happen and then try to talk that over with them. And basically we collaborate to make a plan. Because I always want their input. I'm always wanting them to collaborate with me because if they don't buy into it, nobody's going to get what they want. So it really differ from client to client, but we have lots of theories that we use, and we get all this training that we have to do. So I don't know how to answer it completely because it just depends, but I could definitely diagnose somebody, if they're looking to know, do I really have anxiety? Or is it possibly, because there's a lot of different things that look alike, ADHD, anxiety, some mood disorders. They will maybe present in a certain way, trauma too. And sometimes that's where I think that's probably the best part where we come in, because then we can tease it out and say, it doesn't sound like it's maybe trauma or anxiety. Looks like you really are maybe ADHD and you've never considered, or nobody ever caught it all these years. I mean, that happens a lot.
I feel like you were so spot on with that because especially with Google and internet, it is so easy to try to self-diagnose also.
Yes.
And working in a school district, I can tell you, I feel like parents do that a lot and they shop around.
Yep.
And then they'll go to either a physician or a psychologist or whomever, and then they'll say, my kid has this, when they've never been diagnosed with that. Or maybe they have like so many diagnoses because every time they go to a place, they get a different one. And they've never really stuck with anything and followed through with treatment. And so it's really hard to tease out what the heck is going on. So I love that you said that. Like, I think it's really important for a client to, if they are wanting to like put a label on it, to find a good therapist or social worker and let them do that.
Right, because I think sometimes feel like people think they have anxiety, or it feels like that, but sometimes people have, they think it is, but it's not really clinical anxiety. It's not what we would say. Yes, you probably need to also see your doctor too, because you might want to talk to them about a medication to help with it, or maybe with a naturopath and find something natural for it, or even exercise is really good for different things going on. And sometimes I think people are going around with these ideas in their heads and they maybe really aren't experiencing severe anxiety, or maybe they think it's just, this is what average people go through, and maybe it really is clinical and there's a way to feel better, and maybe you just didn't know it.
Mm-hmm. Well, I do want to, even though I'm going to say what I'm going to say, I do want to also say that I support medication if it's appropriate and needed. I think that there's absolutely a place for it. But I also think that it's great that you just mentioned some kind of natural remedies or homeopathic approaches, because that's what's natural to try to do first. And I don't think that some people in the medical or mental health field, if they feel that way, they don't always present it. So I really appreciate you stating that. And I think it's good if there's anybody considering looking to work with you or a social worker to know that about
Mm-hmm.
you in particular, I guess.
So I hope that answers the question.
Yeah, and let me just talk about it, I guess, a little bit from coaching, even though if somebody came to me and they gave me those diagnoses, I would be a little like, oh, okay, like let's talk about what this really looks
like. Right.
Are you currently seeing someone about this, like that's a mental health professional? Because I am absolutely not a mental health professional. But I have experienced some of my own panic attacks, anxiety, and PTSD. So I feel like it's relatable, at least for me. So I could maybe talk to them initially about, well, first of all, asking them a lot of questions and finding out how they currently handle it. When does it get better or worse for them, and try to help them through that process. And like trying to find some other tools and strategies to use. But again, I think that that's a really, for me, it would be like, oh, okay, so if this isn't working, or if they present themselves being more agitated to me, I would be like, thank you so much for trying, but I feel like we need to go to a mental health professional. I know this great woman, Rebecca Zeleny, that I can refer you to. Yeah, so that would be me from a coaching standpoint.
You know, in a way too, and I think that this is really good, especially if, you know, a coach and a therapist teamed up possibly, because some people, when they hear the word therapist, mental health, they want to walk away from it because it sounds really scary. I think a lot of people have an idea of what it is, but that's not maybe what it is anymore. And if they work with a life coach and then you start questioning, like, wow, this sounds like maybe this is a clinical anxiety and you really should talk to a social worker or therapist, it's a way maybe to, because they've already created a relationship with you, it's a way for you to encourage them to seek that further assistance that they maybe would never have gone to because of being afraid or having certain ideas or judgments about it. Absolutely. It's a way for you to kind of pave the road to further wellness that they would have never thought about.
I completely agree. There are some of those people who, you know, that stigma may be attached to it, or maybe it's
right
attached for them regarding seeking more mental health profession, like a mental health profession standpoint. So a coach could be a great way to kind of take those steps toward seeing a mental health professional and maybe reducing that stigma, or letting them know all of the different options that they have now that maybe they weren't aware of. Like,
right. Yeah.
So great. Well, I would love to talk to you further. So you, Rebecca, do not go anywhere, but
okay.
I'm going to go ahead and end our recording. Thanks for everybody.
Thanks.
Listened in. Yeah. We may do this again, so we'll be looking for your questions. I'll put some posts on my Facebook page. My Facebook page is Dr. Teresa Green, so please feel free to look that up. Rebecca, do you have any websites or anything that you want to throw out?
I have a Facebook page. You can just link it in to, I'll put it on your comments or whatever.
Great. So we'll do that for her connection to connect to Rebecca, but also she had mentioned a really great article that talks about coaching and therapy. So I'll also include that in the comments. So thanks a lot.